Thank you, Count Corla. I'd like to fully support this motion. Like Deputy Brazil, I have to declare an interest. I'm a community pharmacist and a holder of a contract with the state, as is my husband. I'd like to commend RTE for, I suppose, going to the effort of exposing this. But for me, as a community pharmacist, my concerns would be around the fact that there's various proportions of business would be taken up with blister packing or phase dispensing. And in my own business, it's quite a small proportion, but it would average around 10%. And when you're looking at fees accounting or increasing by 60%, it would seem would be Deputy Collins has left, but we probably won't agree on anything else over our term in here, but it would seem very unusual to me that this would not have set off a red light somewhere. Irregular trends in dispensing practice should be easily identifiable by the HSE and by the PCRS, and unless there's some particular reason for these trends. You may have particular spikes in fertility drugs around fertility clinics, or particular spikes in drugs to alleviate symptomatic relief from chemotherapy treatment. You may have spikes in that in pharmacies aligned with certain hospitals. So it should be very obvious and very easy to do. And the PCRS they don't just get a block of that, they get very detailed data from the community pharmacist on an electronic system. So it is beyond me how this could have gone unnoticed and how there was such a defined difference between normal levels of activity and what was going on in these trends, or in these chains. I suppose, from my point of view as a community pharmacist, the blatant promotion of this service and the model, and obviously a company must have been engaged to come up with a flow chart that explained to staff how you would go from a fee of €5 to a fee of €20 for medication. So it was very, very blatant, and I would consider it to be a deliberate manipulation of, I suppose, what we would be bound by ethics and ethical decisions that we would, as community pharmacists, take on. Blister packing or phase dispensing is a very labour-intensive process. It involves a very robust checking procedure, and it is prone to errors. So it is not something, in my experience, and I have vast experience as a community pharmacist, as I locumed for many years before I opened my own business. It's not something that generally community pharmacists would be overly advertising. It would be something that you would do to help a particular patient. And this service is essential for many patients, as Dr. Harty and Deputy Brazil mentioned. Generally, the patients that require this service are patients with specific needs. They may be visually impaired, they may have intellectual disabilities, or they may just be elderly people on multiple medications that adherence to regimes is very important. For me, at this stage, I don't repeat what everybody else has said, but as a result of this, small community pharmacists, I would consider myself one of those, small community pharmacists had issues when we were competing for business in the recessionary times in this country. We were not able to compete, and I don't mean to generalise all community pharmacists, but my experience was we were not able to compete with large multinationals when it came for tendering for business. And as a community pharmacist, I looked at the business that the large chains were doing, and I wondered at times, what was I doing wrong that I wasn't able to get the business that they were doing? But clearly they were working off different profit margins than the rest of us. What is also noticeable, that particular chain of pharmacies bought up an awful lot of pharmacies in Ireland over the last few years, and essentially picked off shops that were in financial difficulty. And that is something that I find, as someone who's completely dedicated in my professional life to being a community pharmacist, I find it very difficult to stomach in light of these revelations. Essentially, what many community pharmacists were dealing with was not a level playing field. I do believe, as a result of this, and I will not go over everything that the Minister has said, but I do believe there is scope there to negotiate, as Deputy Brazil mentioned, a whole new fee structure in this sector. But there's also scope to negotiate with large operators who are benefiting from economies of scale in their business, and there is definitely scope there to save money for the taxpayer in Ireland. I would like to conclude by saying to people at home who are dependent, and to carers who are dependent on this method of delivering medicine, that those in my party and my colleagues with similar backgrounds, I'm sure, will work to retain this service for people in the community. And I would really like that no older person in the community out there tonight will be concerned that this vital service will be taken away from them. I'll conclude by saying that it is absolutely essential when we're dealing with taxpayers' money that there are robust checks and balances in place, and that so many community pharmacists over the country do so much work for people on a daily basis, and as a professional it breaks my heart to see other members of the profession being tarred with the same brush. Thank you, Count Corla.